Thank you for listening to the Gilman Woolsey podcast. This is episode 11. We hope you enjoy the show. So, Jackie, give us an update on what's going on in the United States today.
Well, as everyone can see, the numbers are rapidly growing, especially in places like New York, because we're getting more testing capabilities, and we're just going to see this number grow and grow and grow over the next coming days, weeks. It's going to be a very high number that we're going to start seeing, and it's going to be spread throughout everywhere. So with listening to everything today, I know that everything's changing so rapidly, and it's a little hard to kind of keep up and follow what's happening or what's going to happen. So I've been following the international news daily for about the past month, maybe a little longer, about this. And I just want to give people a little perspective of the populations in different countries and the populations in different states. So Italy, for example, has 60 million people. Spain has a total of 46 million people. So California, which is the highest populated state in the United States, has approximately 40 million people. So I was telling you, Spain, 46 million people. That's only 6 million people more than a whole country. And this is a problem. We started doing travel measurements against some of these countries. I was looking back at March 11th, I think, is when Trump announced that we are going to do the ban on flights from the EU. And at that point, Italy had only 12,000 cases. So Italy has a population of 60,000 people.
60 million.
Or 60 million people, sorry. And they had 12,000 positive cases at that time. And we were banning travel. New York has a lot more cases than that right now. They are nearing 16,000, maybe more now. And they have a population of 19 million. So you can see that this is a problem. People see the United States as a whole, but we are a whole bunch of countries in ourselves. I mean, and you're going to start seeing this over time. We're going to have to start closing borders state to state.
Sure. Well, I mean, the way you have to look at the United States is really basically equivalent to the European Union. Each state is similar in size. There's differences in population, but per capita, for instance, in New York right now, per capita meaning the number of cases per, say, 1,000 or per 100, but the infection rate in New York is actually higher because they have considerably fewer people than Italy. I mean, higher compared to when we did the travel ban, but yet we are allowing people in New York to travel freely back and forth between the other states, either by airplane travel or just driving a car. But then the question becomes, if it's a rational thing to do to shut off travel between Italy when they had 12,000 infected cases, why aren't we shutting off travel right now to New York when they have 15,000 infected cases? Because they have approximately 1/5 of the population, meaning that the average number of infected per 1,000 is going to be about 4 times greater right now in New York than when we did the travel ban. So one other thing that I wanted to say about New York, while we're on the subject of New York, they have released some recent statistics, and 54% of all infections in New York right now are occurring in people between the ages of 10 and 49. So even though we think of it as, this is impacting older people, the truth is that young people are getting this, and mild disease right now in New York, 50% of the mild disease people get pneumonia. And anyone that's had pneumonia will tell you it's a very serious illness when you get pneumonia. I mean, the symptoms are not pleasant, and it really kicks you down for quite a while, even if you recover.
Yeah, that's a great point to bring up. And on top of that, like we were saying, we just strictly do not have the capacity to handle this. People don't realize, like, a lot of people are thinking, oh, there's only 20% of people going to the hospital and this and that. But most hospitals are running at max capacity most times, and they simply are not able to handle this type of situation. I mean, we still are going to have people having heart attacks, strokes, other emergent situations that we have to handle on top of this. And we just don't have the staff. We don't have the supplies. We don't have the housing. We don't have what it takes. And that's why everyone needs to really take this seriously.
From a number standpoint, right now, they're estimating in New York that between 40 and 80% of people will be infected sometime in the next 2 months to say 1 year. So if we do the math, say 40% on the low end, and we'll say that New York has 10 million people, that means you're looking at 4 million people that get infected. So if just 20% of those people end up in the ER, in the hospital, that means that you have 800,000 people that are going to need hospital care out of that group of 4 million. And right now, as we've stated multiple times before, the total capacity for ICU beds is about 3,500, although they are taking drastic measures right now to bring in cruise ships they have the Mercy that's coming over there. I'm sorry, the Comfort. The Mercy's going to California. And they are trying to rapidly increase the availability of beds. But the big question right now is ventilators. And we really don't know what the total capacity of ventilators is going to be in the short term. And one of the other things that Jackie and I have been talking about a lot is the drain possibly between Washington, California, and New York that it's going to have on the rest of the country, because they're infected early. So what happens if a disproportionate amount of the resources to care for these sick people are diverted to New York now? This disease lasts a long time, and you can't just take a ventilator off someone and ship it to a new state or that person dies. So we're worried that you're actually going to see New York and some of these early places do bad, but better than some of the late places, because, say, Utah or Arizona, if we're 3-4 weeks, all the excess capacity, the strategic supply of the United States, could already have gone to these other areas that are hit hard, and then there's just no reserve to go serve the populations that maybe are a couple, 3 weeks delayed in having the big crush that comes.
Yeah, and like I was saying, the EU is pretty much the same as America. I mean, they're kind of all together in a sense. And if you put it all together, it's the size of the United States. But you're already seeing that over there as well. I was just reading in the Italian newspaper today that they had a whole bunch of masks from China that were supposed to be coming to them, and they were
them being Italy, they were coming to Italy.
They were coming to Italy, and they were seized in the Czech Republic by officials. They claimed that it was illegal trafficking of goods, and they seized all the goods, and there was 680,000 masks in there and ventilators. And I don't know how many ventilators, but I know there is 680,000 masks, and they don't know if it was on purpose, if it was an accident, but it is something that's created great tension, because Italy is in a crisis. Prague and the Czech Republic, that area is not in that situation yet, but they see it coming. They have over 1,000 cases there, and everyone's just looking out for their best interest. So Prague, out of 680,000 of those masks, they actually distributed 380,000 to their own hospitals.
Right, and that's the thing that I'm expecting in the United States. Right now, there's a high degree of cooperation between the states, but our states are highly autonomous, governed societies. Even our cities have a fair amount of autonomy between them. And as this crisis worsens, like we expect it will, and I'm going to take a little diversion here. A lot of people have been telling me that they think that I'm a doomsdayer and that I have all these terrible predictions. But thus far, all the things that we've been talking about have happened. And it's not that have some sort of, insight or clairvoyance into the future. It's just that we're watching the other countries and we're comparing ourselves to other countries, and we're saying, what countries are we most like? And we are most like Italy and Europe. We are not like the Asian countries. Our response has not been like the Asian countries, and so we expect to follow a similar pathway to the Asian countries. But as I was saying, with the individual states, they're all highly autonomous, and at some point in time, we are both expecting that people are going to become increasingly protective. As our episode yesterday, the person in Albuquerque I was talking to, he was saying the same thing. This was actually, I think, after the call had ended, we were having a conversation, but he said their level 1 trauma center was not actually kicking down supplies to other places that had more of a supply need. And they were saying, well, we're more of a critical access hospital. We have to retain these for ourselves. But everyone's afraid of running out of stuff right now. And if you give up what little you have, chances are, well, not chances, but you will run out quicker. It's just a matter of time when you run out. So sharing just means that you run out and you expose your people sooner than you would have otherwise.
So when you're talking about how we're more like Italy and Europe, and not like the Asian countries, can you emphasize more on like what's going on in the Asian countries with it? What measures are they taking that are different than what we're doing and what Europe's doing?
Yeah, this is something we've touched on a number of times, but basically over in the Asian countries, because of past experiences that they've had in South Korea, they had the MERS outbreak. In Singapore and in Taiwan, they had issue with SARS, but they had built up their infrastructure. They had protocols in place. They had rapid testing capabilities that were able to come online faster because they had experienced this before. But all of these countries had a 3-prong procedure that they have been very rigorous in. The first was aggressive testing. They tested anyone with symptoms. The second was extensive contact tracing, where they would go and they would find everyone that this person had been exposed to. And the third was isolation or quarantine. Anyone that had potentially been exposed to a person that was infected, they would put them into a 14-day quarantine, and they were very strict about it. There were severe penalties for actually breaking the quarantine once you were ordered to quarantine.
So with the quarantine measures, what do you think with in regards to other countries having their curve, I guess, flattened, which we're trying to do? What measures do you think we're going to have to get to really contain this?
Well, the thing right now is if you look at, say, Italy, excuse me, Italy has been trying to flatten their curve, and to date, their curve has actually continued to skyrocket. And I think this is a really important point to make, because a lot of people make arguments because they look at the data today and they try to say, well, we're not going to be like this, or we're not going to be like that. But if you look at every single country that has tried to curb their crisis, what happens is there's about a 3-week lag from the time that you impose very, very strict quarantine till you actually see the curve flatten. That's not go down, that's flatten. And even in Italy, you've seen this, is they've imposed stronger and stronger quarantine measures, but their numbers have continued to go up. The reason for that 3-week lag is because it takes about 3 weeks for the average person to go from getting infected till they run into a severe situation where they have to go to the hospital. And so that's where the real crunch and the real crisis comes. So right now in New York, for instance, we have people are looking, they're saying, well, the numbers are low. And my question to them is, well, when were different groups of people infected? Because we would expect over the coming 2 to 3 weeks that all of those people that are infected now, they're, whatever proportion, which is approximately 20% based on history, whatever proportion gets into trouble in 2 to 3 weeks is going to be hitting hard in New York. And that's when you're really going to see the crisis in New York happen.
Yeah. And like I said, everyone really needs to look at these numbers, like the populations, the amount infected, because we're behind. We're very much behind a lot of these other countries, and a lot of people are still not taking this seriously, but there's so many more people infected here than people know. And we're just showing up late. But I want to touch on a positive note. I do think that we have excellent resources here in the United States. We have the breweries and distilleries that are going to convert into making hand sanitizers, and we have the automobile industry that's going to be making ventilators, and we have a lot of great resources here in America. And I know in Madrid, they've been hit very, very hard with this, and they actually cleared out an entire conference. A conference building, and they have transformed it into a 5,500 bed hospital, and it actually is capable of 500 ICU beds. And I mean, I know that I don't know their medical system there, but I know the United States has a lot of resources, a lot of factories, a lot of everything. And that's one hopeful thing for us.
Well, this is one area that I think the U.S. has a leg up compared to the countries in Europe, because we've had the example of China now, we've had the example of South Korea, and now we've had the example of Europe. And one thing that we've seen in Europe is that when the numbers start to increase, we do need more hospital beds. It's a given. And so all around the country right now, in Arizona, in Nevada, in Washington, in California, in New York, in New Jersey, all over, they are actually building temporary hospital facilities. Different places are implementing this in different ways, but the takeaway is that we are creating spaces where medical care can be administered. The big question right now is the availability of drugs and the availability of medical devices, because space and beds are easier to create than drugs and medical devices.
And personnel as well, because as you know, we're all vulnerable. I mean, we're the most vulnerable being in the healthcare, and as people get infected, there's going to be shortages of staff as well. So I think it's very smart that they're lifting the red tape with getting certifications and allowing doctors to practice across state lines without going through the typical rigmarole of credentialing and stuff. So it's good that I mean, I am very proud of our president for really just getting the ball rolling on things fast.
Yeah, and I'm very happy with Trump, and I'll have a disclaimer here. Both Jackie and I are big Trump supporters, but the speed that we're going, at least based on what we're seeing in Europe, I still don't think is fast enough, though. One of the things that we did see today over in Italy is that they actually instituted what I would describe as a military-based quarantine, whereas before they were fining people and the police were kind of enforcing people to stay at home, but now they actually have the military out in full scale, and they have now restricted movement between individual cities. So wherever you are, you're expected to stay put in that location unless you are part of very critical infrastructure, like moving supplies around or medical personnel or other people.
Yeah. So. And like I said a couple episodes ago, when we were talking about Italy and the quarantine, I mean, of course, it's been hitting everyone hard. No one wants to stay inside all the time. And there's people that are going to disobey, and that's why they had to start getting strict, because they are completely just crumbling there. And the citizens are starting to get upset about it because they have loved ones dying that they can't even see. They are starting to have iPad chats with their family members that are in the hospital. Some of them getting ready to die. And at first they thought it would not be a good thing, but it's what's the way things are going in Italy. It's just so horrific. And the citizens are getting fed up with it. They're like, we don't care. We don't care if you close down everything. And you we want more enforcement, because we want to get over this. We want to get back to our normal lives, and we have loved ones dying, and they're actually getting very upset about it.
And unfortunately, in the United States, we're going down some pathways that I do not think are good. The first is the president and the task force right now have been pushing for this 15-day plan. But I want to say unequivocally, in my opinion, this plan has failed because it is not nearly strict enough. and the numbers support that. So when the 15-day plan was instituted around March 14th, our daily rate of infections was about 696 new infections daily. As of today, which is the 22nd, there is 9,339 new infections. So we are halfway through this 15-day plan, and yet we have had almost a 10 times increase, in fact, more than a 10 times increase in the number of daily infections. And this is one of the things that we were talking about even when this plan was instituted. This plan is a good initial start, but it's not going to be enough to actually flatten the curve. All it's going to do is it's going to slow down the rate of acceleration a little bit. And one of the problems with this plan or any other plan, and this was another thing that we had brought up before, it takes about 3 weeks to see the effect of a plan to begin with. And so even doing a 15-day plan doesn't even make sense because you're not going to see the effect until after the 15-day plan is well over. And the rate that this disease spreads, you can't really afford to be wrong because it means a massive mushrooming of the disease that possibly could have been curtailed at an earlier phase. So,
Yeah, and I'm really hoping, because I was hoping actually over a week ago that Trump would have already grounded all air travel throughout the states. And like I said, we're all our own countries, and he's been leaving it up to the states to make these decisions like they're their own countries. And I'm really, really hoping that they're New York or California, one of them hits a situation that's just so bad, or maybe a couple places that he just decides, no, this is what we have to do for the nation. We just have to take these strict measures and just shut it down.
Yeah, and I mean, it's not that we're hoping, we're expecting this to happen based on the patterns that we're seeing.
Sooner rather than later, though, because to me, the longer that we have this free move around all over, it's just we're spreading with the airports being open, with the subways being open, with the train stations being open, with everything. It's you're transmitting everywhere, and the longer that we go with these like light guidelines and stuff, because there's good people, there's bad people, there's teenagers, there's kids that are immature, they don't understand everything going on, they don't care, and these guidelines aren't going to stop it. Like, strict action has to be taken, and I'm hoping sooner rather than later that they can see that this is what has to happen, because the longer we don't, the more it spreads.
Well, you've seen this exact pattern over in Europe, is as the restrictions get more and more and more rigorous, more and more people comply. But early on, and in fact, through pretty much the point that you get to full legal military scale lockdown, young people in particular tend to very much violate these types of policies. One other thing that I wanted to touch on really briefly, where I think the United States is going grossly wrong at this point in time, is the testing recommendations that we have. And I'm not sure if it's because we don't have sufficient tests to test widely, but our testing distribution is very uneven. In New York, we're doing a lot of testing. In Arizona right now, we're not doing a lot of testing. But the recommendations that they just came out with was that basically we did not test people, even if we suspected that they had the infection, unless the medical professionals believed that knowing if they were positive would change the way that they treated them. I think the danger of doing this is that we can't track the disease. We don't know if it's getting better, and we don't know if it's getting worse. And over time, we need to be able to track this, and we need to be able to make decisions off of data. And if we're not collecting the data, it's going to impair our ability to make good decisions.
Yeah, and even in Italy, they were saying that they've had a lot of deaths, but because they've been so overwhelmed, people have died, but they don't know if it's because of the virus either, and they haven't been testing those people too. So their death toll actually could be a lot higher than what they're even reporting. It's just that it's been overwhelming, and they have to, test the people that are still alive, that they don't worry about the people that are already dead.
Right. And right now in the United States, we have some of the best medical companies on the planet. And that gives me a lot of hope. One of the things that they've done in recent days is rushed a what we call a rapid test through the FDA. With this rapid test, we'll be able to get results and know within about 45 minutes if someone tests positive for coronavirus instead of waiting 1, 2, 3 days. That does a couple of things. One, I'm hoping that they will change the policy on who can get tested as this test comes online. The other thing is you can get disposition quicker, know what to do with the patient, and if you send them home, people being able to have a positive test, but not enough or not severe enough symptoms to stay in the hospital, that they will take it more seriously and hopefully not infect as many people at home or in the community, knowing that for 100% they have the coronavirus and they can't, be in denial and still go out and infect other people.
Yeah, I mean, this is a great thing that is in development. The only thing with this is it will probably create more panic because the more people, like I said, that are getting tested and the more rapid results are coming out, you're just going to see numbers skyrocket. And if isolation is the only way to contain this, it's going to be really hard on our healthcare systems. Like I said, we're the most vulnerable for contracting this. Us grocery store workers, law enforcement, etc. And if we catch this, like, we have to be careful because we don't want to give it to our patients that are immunocompromised or whatnot.
I will disagree with you a little bit on this point. I think the panic is inevitable because I think the panic is going to be as much related to the number of deaths that people are seeing in the community. So whether we're testing people or not, I think that the panic is inevitable just based on people seeing their neighbors going into the hospital and dying. But I think the real value of testing is that it provides social proof that people really need to take this serious. They need to stay away from other people, and that, hopefully we can get ahead of it instead of having it being a lagging indicator when people start dying, which happens much after they would normally test positive.
Yeah, I agree. Well, should we wrap it up here for the night?
I actually wanted to discuss one more thing before we signed off tonight. I wanted to talk a little bit about chloroquine before we signed off. So one of the things, I've been getting a tremendous amount of questions about chloroquine, and I know we touched on this briefly. So I did a bunch of research on chloroquine because I wanted to know how reasonable of a solution chloroquine actually would be to treating coronavirus. In my research, I found a couple of interesting things, and this is going to be slightly technical, but I think it's interesting and it's worthwhile. So the way that chloroquine works is it actually is something called an ionophore. And what an ionophore does is it transports ions into the cells. Specifically, chloroquine and hydroxychloroquine, which are very similar drugs, what they do is they get zinc ions from the outside of the cell into a structure in the cell called lysosomes. Now, a little bit more research, I also found that this particular virus, the coronavirus, to get into the cell, it binds to the ACE receptor that we had talked about before on the outside of the cell, but it has to use the lysosome, which is a structure inside the cell, to actually gain entry into the cell, to inject its DNA into the cell. And chloroquine actually disrupts the function of the lysosome that we were describing a minute ago. And so in theory, it seems like from at least a mechanism standpoint, there is a reason why chloroquine could work. And this gives me a tremendous amount of hope that we are going to be able to treat patients with this. The other thing that I can report to you is that friends of mine who are physicians in Seattle are saying that they're giving patients a 5-day course of chloroquine who basically just have respiratory symptoms alone indicative of a coronavirus infection. So hopefully, based on their experience within a couple weeks, we'll have some good data coming in and we'll be able to more conclusively say whether we think chloroquine is going to be a reasonable solution to treat coronavirus or not.
Yeah, we're very hopeful for it. And like we said, we're not recommending anyone take it, but it's something you should talk to your doctor about. If either of us got it, we'd probably take it if we were having symptoms, because it's been a drug on the market for a long time and has been proven to be fairly safe. So in simple terms, what Gilman was just saying is that through research, they've pretty much found that this drug almost acts like a shield around your cell. There's something that this virus needs to get into your cell, and it's disrupted by this drug, so it can't enter. So it's pretty much like a shield, which is excellent, not only because it will help you from spreading the infection inside your own body once you get it, but also it could be, if you take it before you're even infected, it could protect you.
Yeah, well, and this is actually a very interesting point that's come up recently. We're seeing very low levels of infection in Africa. And one of the speculations why that might be is because malaria is very common in Africa, and there's a lot of people on prophylaxis. Prophylaxis means you give people a drug to prevent them from getting a disease. And people are wondering if it's this prophylaxis for malaria in Africa that's actually causing the reduction of the number of infections that we're seeing there.
Yeah, we'll have to look into that a little more. But anyways, thank you for joining us tonight. And I might not be on for the next few episodes. I am going into war zone tomorrow. Unfortunately, hopefully it's not a war zone yet, but I have to go back to work. I've been on vacay for the past 7 days when I was supposed to be in Ireland. So I've just been working on this podcast.
And so we'll have a little bit of more inside information from actually being in the hot zone. Hopefully it's not too hot, but we'll find out. So
yeah, I hope I don't have to use a scarf to take care of patients.
Right. So sounds good. Well, stay well, everyone, and good night.
All right. Have a good night. Bye.
Thank you for listening to the Gilman Woolsey podcast. We hope you enjoyed our show. As always, if you have information that you would like to share with us, or if you would like to come on our show, please contact us at COVID at gilmanwoolsey.com. We're always looking for new perspectives and to get an idea of what's going on out there. Thank you. Have a good night and be safe.